My name is Dr. Avik Dandapat, and I'm the Clinical Director of the Dental Implant Centre in Twyford. We have a group of practices around the UK, all providing implants to patients, and we only use Vatech CBCT scanners. Myself, I've been doing implants for about 24 years. I've completed a master's degree in dental implantology at the University of Leeds and completed my diploma, and I'm a fellow of the College of General Dentists in Birmingham. And I'm also the CEO and Educational Director of the Implant Diploma Programme that we run here in the Institute. So this is my CBCT scanner by Vatech, and it is an essential bit of kit. The reason for, I believe, every dentist, not only implant surgeons, every dentist will be benefiting from this, is the three-dimensional information that you get is so much more than what you get on a two-dimensional image, especially with your periapicals and things like that. You cannot look at things like tooth cracks. You can't see, you might have patients with some strange symptoms and the crack might be in a different plane. This machine will show you everything in 3D. And once it renders that, it just gives every dentist so much more information. So getting into CBCTs and understanding them will just make your dentistry that much better, that your diagnosis is much clearer, and you'll just generally be a better clinician. So for me, it's something that I've used for the last over 20 years of using CBCT scans in my practice, and I think it's a tool that I cannot live without. And without a doubt in my mind, I'd recommend Vatech scanners because they are some of the clearest images that I've seen, and I've used other scanners. I always go back to Vatech. The machine is ease of use, right? Because everyone can use it really well, very easy to line up. The system actually calibrates itself really well, and it's quick as well, so the scanning is not long. It plays some lovely music for the patients. They don't feel anxious when they're using the machine. We just find it a reproducible image every single time. The positioning is good with our patients. It's not difficult to position the patient with CBCT, and it's ease of use. The software is very intuitive. It gives you guidance on every stage that you need to do to actually position the patients, and it's very simple, and we're very happy with that. I think if you want to stand out from the crowd, yes, you have to factor that CBCT into your initial costs, okay? There's lots of ways the machine can pay for itself, okay? So the first thing you do is when you are opening a squat in an area, you phone your local maxillofacial department up in the hospital and you inform them that you're installing a localized CBCT scanner. And you can get NHS referrals to do the CBCT scans for the hospitals, and that can pay for the machines. That's number one. And that's an easy way to gain some income. The other way is obviously with the patients, they will come in and you do a nominal fee for a CBCT scan, but if you are delivering excellence, the patients will recognize it, and they will get more case acceptance, more people will choose your clinic because you have the latest technology. And if you don't have the latest technology, you're falling behind. So if you're doing a squat, by all means, the main thing is visualizing data and reproducing that data to a presentation to your patients as part of your consultation technique. It's an essential tool. It's something that will pay for itself tenfold over a year's period, easily. So you never think of it as a cost, it's an essential tool. A company that's based on excellence because they always strive for the best in imaging quality with their machines. I have had no problems in 20 years of using their machines, of not one of their machines failing on me or having no problems at all. So as far as I'm concerned, Vatech is the best imaging company for the use of CBCT scanning in dentistry.
Thank you.
You're welcome.